You are listening to the
World Extreme.
World Extreme Medicine.
The World Extreme Medicine
Podcast.
Welcome back to the World Extreme Medicine Podcast. I am Dr. Sarah Spelsberg, and I'm your host for this edition, Beyond the Stars, Packing the Perfect Space Medical Kit. Our guest tonight is Dr. Michael Harrison from Axiom Space. In this episode, we're going to discuss special considerations for packing both your medical kit and the rest of your kit for space. So Dr. Michael Harrison is the Chief Medical Officer and Operational Flight Surgeon of Axiom Space, where he supports private astronaut missions in all aspects, including candidate selection, training, mission launch, and in-flight medical care administration. Prior to joining Axiom Space, Dr. Harrison served as a flight surgeon supporting multiple commercial spaceflight missions at SpaceX and Virgin Galactic. He's been involved in aerospace medical research since 2004. His research interests include spaceflight, military aviation, decompression, high-altitude physiology, and he has 45 peer-reviewed articles spread across each focus area. He has practiced medicine for over 12 years and is currently practicing at the Mayo Clinic in Jacksonville, Florida. He holds a medical degree from Saba University School of Medicine in the Caribbean, Netherlands, and a PhD in philosophy from the University of Regina in Canada. He's a fellow of the Aerospace Medical Association, a nitrox certified rescue diver, an instrument-rated private pilot, and a 3-time Ironman finisher. So Mike, thank you so much for joining us on the World Extreme Medicine Podcast. I'm just so excited to have you here.
Of course. Thank you. I'm excited to be here too.
Yes. And so before we deep dive into packing, can you tell me a little bit about what Axiom Space does and how the medical team plays a critical role there?
Definitely. So at Axiom Space, our motto is that we're building for beyond. And so we are opening up low Earth orbit to extend it beyond what has been the traditional model, where a government agency sends a small select crew of astronauts to a space station, and they live and work there and come back. We're opening it up to the rest of the world and the rest of the population, that if somebody has a science project or a research experiment or something that they want to manufacture in low Earth orbit, we're going to be the platform on which that occurs. And so at Axiom Space in the medical community, what we're doing is facilitating that, because traditionally the governmental agencies have down selected to minimize risk. So they get thousands of applicants, and they choose single to double digit candidates that they're going to train as astronauts and eventually fly. That's not a model that's sustainable for a commercial company, right? In order to achieve our goal, we want to be able to make it so that everybody can fly to space, and people are people. So they're going to show up with medical conditions that traditionally may have been disqualifying, but for our model don't have to be. And so it's up to us to come up with a way to safely fly these folks, right? We still want to quantify that. We want to assess the risk. We want to quantify it. And then we want to come up with an approach that's going to mitigate that risk and safely support these folks over the course of their mission. And for those of us in the medical department at Axiom Space, that's incredibly exciting, because that's an opportunity to really start to practice medicine and to come up with some unique solutions. The best part about all of that is that some of the solutions that we come up with to support crews that are going to our station when it flies will have impacts on how we treat certain conditions and manage things here on Earth. And we'll open up some possibilities for folks terrestrially.
I got goosebumps as you were saying that. And
Yeah,
I just
it's
think,
exciting.
I think of all the astronaut hopefuls out there who are just like, oh, this is my shot. Maybe this will happen in my lifetime. Oh,
Yeah.
this is so exciting. And we can dive right into this too. Like, how does one pack for space? Like, how do you pack your medical kit? How many pairs of underpants do you take? Like, can you do laundry up there?
So luckily, underwear doesn't fall under the purview of the medical department. We have a department that manages packing for the crew. So I'm happy to leave that up to them. But the answer overall is very carefully. Everything you take into space with you has to serve a purpose, and ideally has to serve multiple purposes when it comes to the medical kits. And so what we do, it starts with that risk assessment that we do, quantification, and then into the mitigation is how we're going to pack our medical kits. You start looking at the conditions that are likely to happen and come up with how you're going to manage those if they happen in the course of the mission. And luckily, we have a lot of data. NASA and the other international partners have had medical events over the course of their 60 years of human spaceflight. So we have a model for what you expect to happen. Back pain is incredibly common. nausea, space motion sickness, space adaptation sickness, also incredibly common, right? Up to 70% of astronauts experience this. And this includes even astronauts that have got experience flying in a high performance aircraft or something like that, that getting to space can mess with your inner ear, for lack of a better way of describing it. And the mismatch that you get between your ear and your eyes can make you feel motion sick. So things like that, we know are going to happen. So we pack medicines to help support that. Getting things in your eye are also incredibly common, because if you drop something here, it goes on the floor and you can sweep it up later. You drop something in microgravity, it floats around until it bumps into something else, right? Newton's third law reigns supreme in orbit. And so you'll get things in your eye, and coming up with how you irrigate that and manage that, work it up, is important. Then there are other things, right? You can start getting into some of the emergencies. What happens if somebody has difficulty breathing or somebody has cardiac arrest? And you can find research and activities being done in zero-G, either on a parabolic flight or drills in the ISS, where they come up with ways that they'll do CPR in space and things like that. Those are less likely to occur, right? If we've done our job well here on the ground, planning for the mission, then fingers crossed, hopefully it doesn't happen in space. So high impact, low probability. You still have to pack for some of those, but you also have to pack with a sense of, do I have the skill set on board that is going to be able to provide the care that you need? And just because you've got the medical capabilities in the forms of the equipment, the medications, and whatnot, do you have a provider up there that is capable of performing that particular skill? So it's an art, and it's a balance, and it comes back to risk, right? You're looking at what you think the risk is, what you're willing to accept, what you're willing to intervene upon, and then what is the endpoint? Just because you can start a procedure doesn't necessarily mean that you can take it to completion. And so that's something else that you have to factor into it. So we're hoping not to ever have to deal with one of those bad days. So back to the original question, right? You're packing carefully. Some of the things that you take may not necessarily be the first line medicine for condition X on Earth, right? Some of the antibiotics that we take are going to be very similar to what you see for a wilderness medicine trip. That I'm not going to take my vancomycin and my Zosyn and all the other high-end, very specific or big gun IV medications. I'm going to start packing the doxycyclines and the Bactrums and the ones that are second and third line potentially for things, but are second and third line for a wide variety of conditions. So that way you've got one formulary that can cover a number of things. And as a result of that, you've decreased the size of your med kit, which is also important because mass is a significant consideration when you have to launch something into space.
Absolutely. And I had a fun conversation with astronaut Kjell Lindgren, where we actually found that we basically packed like the same things in our kit. Like, so for me, Arctic based land and what I sent undersea with Deturi when he did the undersea habitat Project Neptune 100 mission, it was the same. It was literally the same kit as what he packs for space, like a butterfly ultrasound and like the broad spectrum medications.
Astronauts have described going to space as a really messy camping experience. So there's a lot of
where everything just flies away if you don't have it tacked down.
Yep.
That's outstanding. And so you are quadruple boarded. How did this happen? like
a little by accident, which isn't exactly true. I always joke that there's probably a high school guidance counselor somewhere that should be fired if they haven't retired already, because there was probably a quicker way to become a flight surgeon. I'm not saying that everybody needs quadruple boarded, but it was done intentionally. So my primary residency was a quadruple boarded program at Henry Ford Hospital in Detroit. They have a combined internal medicine, emergency medicine, critical care program, where normally getting all three of those boards would take 8 years, but with the overlap between those, so similar to packing for space, right? There are certain rotations that satisfy all three boards. And so you can, if you do them back to back to back like that, you can start counting them across those three boards. And so it only took 6 years to do it that way. And when I did it, I started in 2012 and the last shuttle flight was in 2011. So it became apparent to me that we were going to start launching people to space from different locations than we have in the past, and we're probably going to start returning them to different locations than we have in the past. Or the model that was occurring at the time was in Kazakhstan. And so the Russian space program was launching out of Kazakhstan and landing there as well in very remote settings. And so if you had an astronaut that had come back that had a medical event that needed intervening upon, I figured that having a background in internal medicine, emergency medicine, and critical care was probably about as close as you could get in terms of having a skill set that could handle pretty much whatever it was. And if it was surgical, nobody was going to manage a surgical condition in the field anyway. You were still going to fly faster, right? You were going to use jet fuel as your prime resuscitation fluid and just fly them to definitive care. But the ER doctor was going to be the one that was going to stabilize them during flight. So when I said that at my residency interview, because they took 2 candidates per year, and they asked, why would you want to do a program like this? This was similar to what my answer was at the time. And I believe they were probably considering getting a behavioral health consult because it probably sounded crazy to them, but it worked out. And I rolled from there into Mayo's aerospace program, did a 2-year fellowship in aerospace medicine at about the time that some of the commercial programs were really taking off. So I got an opportunity to support some of the very early orbital commercial missions, and it just grew from there.
That is so cool. I
Right place
love
at the right time.
Absolutely. And the fortitude to persevere through all of that is very impressive.
It was fun. And I think that's probably the part that allowed me to be as successful as I have been and to complete it all, right? 8 years of medical training after med school is a long time, but I enjoyed it. And I think that that's a big thing for anybody, right? If you enjoy what you're doing at work, it doesn't seem so much like working it. It's not a chore. It's not a task that's onerous. It's something that you're passionate about and you find fulfilling. So I've been fortunate.
Absolutely. I love my residency. My residency is at UNC Southeastern, and it's just, you just learn so many interesting things every day. And it really is, what we get to do is amazing. It's so much fun.
Incredible. Yeah.
So what are some, like, I always say I need duct tape, safety pins, paper clips, my arc light, ophthalmoscope, otoscope, my butterfly ultrasound. Like, what are some of the essential items that you think should be included in a medical kit for space travel?
So we've got the basics. We've got, as I said, some of the medications, some broad spectrum antibiotics that you can take by mouth, over-the-counter pain medicine, Tylenol, Motrin, things like that to deal with the back pain or some of the overuse injuries, so the sprains and strains that can occur in space. And people bump into stuff too. Quick wound repair things. So Dermabond, butterflies, right? The butterfly steri strips, things like that. Some of the basics. And then we get some of the more unique things. There's the capability to do some sutures and some stapling if it's a really big skin wound and a laceration. Again, like I said, you bump into things. So getting a wound on your head's not necessarily that uncommon. And having a head wound, you know that they bleed fairly profusely, even if they're small. And so getting those addressed are important. And then some of the kits that we have on the ground. I've talked to folks in the past about what I put in the flight suit, right? And the flight suit that you wear to a launch and a landing operation has got a bunch of pockets. And I usually joke with folks that I've got my pockets filled with cookies and crayons, but I've actually got more important things in there. Nail clippers. Dr. Richard Jennings, who's one of the grandfathers of aerospace medicine, one of the pioneers doing some of the very early work with NASA and some of the other commercial flights with spaceflight adventures, always says that having a set of nail clippers in your flight suit pocket, you can use them for a number of different things. And he's right? You can use them to cut thread. You can use them to cut nails. You can use them to cut other things. They've got a file. They've got a whatever the thing is that you get the dirt out from underneath your nails. I don't know what the technical term is for that, but you can use that as a screwdriver if you have to. You can start pulling things out, like splinters you can tease out with that. I've got Afrin in case somebody's got a sinus block, ibuprofen for basic pain meds, and then a set of trauma shears, a pen light, a couple of Sharpies, a stethoscope, and a pulse ox. So it's very basic stuff, right? You have to be able to ask yourself those same questions. What am I likely to encounter? What am I likely going to be able to intervene upon? And what are my limits? In which case you need to do a hard stop. And as I said, either fly faster or come up with a different approach.
That sounds like the things I have in my purse.
It's like a Boy Scout, ready for anything.
I love it. Yeah. I mean, when I used to fly medevac, I kind of put everything in my vest, because if my bag is like packed in the back, like behind the, extra stretcher and all that stuff, like, and we go down, who knows where it's going to end up? Like, you need to have it on you. I love that. That's a great idea. And the nail clippers thing, that's brilliant.
Yeah, the arm pocket's a great spot for that.
I'm going to add those. For sure. And so I would be mortified if I bumped my head and bled all over the space station. So what other like specific challenges happen to physician astronauts when it comes to medical care in space? Like, what are some examples of things that have happened?
So it's the common stuff. They get foreign bodies in the eyes. People have back pain. Sinus congestion is a big issue just as a result of the fluid shifts. And it sort of responds to therapy, but the pathology is different than what it is, right? If you have allergies or hay fever or something like that that's causing some congestion, where pseudoephedrine may give you some relief. You may get some relief with it from space, but not the same as you will here on Earth. For the most part, and I'm knocking on wood if I can find some, there haven't been big medical emergencies in space that have required intervention. And NASA's proud of the fact, and they should be, that they've never had to end a mission for an early evac for a medical condition. That the folks that they picked and the hard work that they've done in the preventive phase leading up to a mission and the prep has been successful overall. And that's a model that at Axiom Space we're trying to replicate, because bringing somebody back early while it's possible is a big undertaking and has a significant impact on not only the mission of that particular astronaut, but in the case of Axiom Space, where we've got a couple of different customers on board, it impacts them as well. And it's going to have an impact on NASA because it's going to impact operations on the ISS. The physician astronauts that are employed by the governmental agencies, for the most part, aren't practicing medicine as much as they were as a physician, right? Their primary focus on training is the duties of an astronaut, and less so maintaining medical skills. So while they may be up there as a physician and probably are going to be much better trained than the traditional crew medical officer, who could be any member of the crew, and the hours that they receive in training are significantly less than you and I are getting in a residency program. It may have been a while since they put a catheter in somebody for urinary retention or something like that. And it's probably going to be the first time that they've done it in a microgravity environment. And the same thing, there's a video. Tom Marshburn is an astronaut physician, most recently flew on Crew 3, and he's currently the chief medical officer over at Aerospace. There's a video of him when he gets back to Earth where he puts something where he expects it to stay because he's just been on orbit, and it falls to the ground and he looks surprised. It's a joke video. He's doing it facetiously, but it gets the point across, right? The things that you would just put down on the Mayo stand in the trauma bay and expect to be able to pick up when you turn around and need it later may have floated off to somewhere else in the space station. So the training that they do for crew medical officers on space involves a lot of tape, because that's how you're going to secure things to a surface so they don't float off and you don't lose them, which can be annoying if it's something like the Band-Aid or a gauze strip, or it can be dangerous if it's something like a sharp, a needle or a pair of scissors or a scalpel. You don't want those floating around and going missing.
Do they have magnetic patches on them, like on the suit, or like where you could just like put your...
Oh, but that would be a good idea.
It's not a terrible idea, right? Or on your arm,
awesome
you could just
idea.
have a magnetic, you can,
Yeah.
There you go. My gift to you, Axiom,
I
a
was gonna
magnetic
say,
patch on the suit. Just put it right
you
there.
want to hold on to that idea and patent it.
I don't have the time.
Mini magnet.
I don't have time for that. But we use them in the OR, for
Yeah.
some things. And so why couldn't you just have a little, I mean, it would mean you'd magnetize to other things too, but
Yeah.
it's a weak enough magnet that it would hold your thing. And it's
That's a
something.
great idea.
Oh, thank you. So how does microgravity, I mean, how do you I guess you train in water and you train in parabolic flights, but like, how do you train to do what we do if you're having to wear all the gear, or even if you're just without any gravity, like how do they specifically train for that?
So the training that the entire crew goes through, because everybody gets emergency medical training before they go to the International Space Station, is done in a classroom, and it's done to simulate things. Again, they're put in that context of, you can put something down here because you're in a classroom in Houston, but when you're on the ISS, that's why that strip of tape was in the checklist and the procedure, that you're going to put that down so that it's there. So that they become very familiar with the checklists and the procedures that they're going to use when they have to use the medical kit, if they ever have to use it, and where things are. And it's given to them an orientation of, right, it'll be across from this thing, because what you see as the floor may not necessarily be the floor, depending on how you've entered that particular hallway and pathway. So they're given that particular context. The good news with the ISS is that it's a shirt sleeve environment, so they're not wearing their EVA or other bulky spacesuits. They don't have to wear a pressure garment. They're going to be wearing very similar to what you and I are wearing, right? A button down or a t-shirt and a pair of pants. I think that NASA gets their pants from Cabela's.
Nice. I like Cabela's.
Yep.
That's great. Okay. So has anyone ever, like, I guess if you vomit, you're going to probably try to do it into like a bag, but has anyone ever, what happens when they do that and they can't? Like, what happens if you get gastroenteritis on the space station?
So that would be a mess. Gastroenteritis would be a mess.
Yeah.
But throwing up in space, unfortunately, is actually fairly common. As I said, a lot of people get nauseated when they first get to the space station. And the reason being, they've got that disconnect, right? The fluid in their inner ear reacts, right? We've got the 3 semicircular canals, and the way you and I can tell our orientation, that we're upright and I just turn my head to the left, is based off of the gravitational impact on that fluid and how it moves in those 3 canals. And that sensory input matches up with what I just saw. If I had my eyes open when I turned to the left, then I'm used to that, right? We evolved in a 1G environment, and our bodies are pretty good at telling how we're moving in time and space in that environment. When you get to space, then that lack of gravity and that lack of impact on that fluid, I could turn my head to the left and my eyes would recognize that, but my inner ear wouldn't necessarily recognize that. And so there'd be a disconnect between what I was seeing and what I was feeling. And that's what motion sickness is, right? If you've ever been sitting at a gate in an airplane and the plane behind you starts to pull back and you catch it out of the periphery, you get that sort of whoa. Or if you're sitting at a stoplight, right? The same thing, that you brace yourself because you think you're moving, but it doesn't feel like you're, right? The disconnect is there. So if you always have that disconnect, because that's a fleeting example, and we recover quickly because you get other sensory input and you know that my car is not moving or my plane's not moving and I don't have to brace. But if you always have that movement, it becomes disorienting and it can become very provocative for folks. And so feeling sick or actually being sick is not uncommon in astronauts, especially when they get to the ISS. They get used to the vehicle that we're flying in right now is the Dragon, SpaceX's Dragon. They get used to that small confine of the Dragon, and they're familiar with it because they entered into the Dragon in a terrestrial setting. And so they know what's up and what's down, and they're familiar with it. When they cross the hatch into the ISS, they're suddenly in a bigger volume area, and some of their crew members may be coming in this way to greet them. Somebody may come down from this way to greet them. That you've got that mismatch in terms of your sensory inputs and then what you're seeing, your frame of reference. And so all of that can be very provocative. What you thought was going to be up may actually be down for somebody else's frame of reference. So if they do throw up, there are bags that they use, emesis bags, similar to what we have in the emergency department, with the exception of having absorbent material inside them. Because when they throw up, you want that material to stay inside the bag and not float away because the bag's still open because they think they might be sick again.
Yeah. Okay. That makes sense. The absorbent material, that makes sense to me.
Yep.
And I love the collaboration, like the private sectors, like Axiom Space, SpaceX, and and even NASA, like there's a lot of public-private collaboration going on. So what is the medical aspect of the work that you're doing with Axiom Space mean for NASA?
So hopefully what we do helps their missions as well. The things that we learn about, right? We take the lessons that they've had, and there are some slides that I use in some of my presentations that I've gotten from NASA that show the medical conditions that have flown to space, right? So if you look them up, Barrett's textbook, one of the prime textbooks that we use in space medicine, has got charts in there that list the disqualifying conditions. And it looks pretty onerous, right? That you really have to thread the needle from a health perspective to get selected as an astronaut if you're qualified. But similar to what you'll see in the aviation industry here on Earth, people are going to develop medical conditions over the course of their career. And if an astronaut's career is 10, 15, 20 years, it's unreasonable to expect that there isn't something that's going to occur. They may develop high blood pressure. They may have a gallstone that requires surgery. Who knows, right? They may fall off their bike while they're training and break an arm and need a plate put in or something like that. If an airplane, right, has a mechanical issue, the airline industry doesn't throw the airplane away and buy a brand new one. If you've invested a lot of time in training an astronaut and they develop a mechanical issue or a medical condition, you're not going to disqualify that astronaut because you've invested time, they've got expertise. You're going to come up with a way to medically qualify them to return to flight status. The military does that. The commercial airline industry does that. We've got a lot of practice with that. What we're going to do at Axiom Space is we're going to start building upon that, where we're not necessarily requalifying somebody who's been trained, but we're going to accept somebody who's got a medical condition, and we're going to come up with a way to qualify them for space. And the key word in all of that is to do it safely, right? We have an obligation to our patient, who's the astronaut, but we also have an obligation to the industry that we're in such a new area that if somebody does something irresponsible in the industry or has a bad day, it doesn't matter what company they're working at, there are going to be ramifications that are felt across the industry. And right now we're lucky that we're in a grace period that the FAA, the federal government, have allowed us that freedom to start doing some of that work that they haven't over-regulated at the beginning. And they're doing that specifically to allow us the freedom to grow and to innovate and to develop solutions that early regulations, not fully understanding the industry, may have stifled or prevented altogether. And so those are the things that we're doing at Axiom Space to fulfill our goals, right? We're building for beyond, and we're trying to make space something that the entirety of humanity can go to. Some of that stuff is low-hanging fruit too, right? Yeah. If you start looking at some of the conditions that have never gone to space, you'll find things like color vision deficiency or diabetes.
Yeah.
But then if you look at what people with diabetes have done on Earth, it's incredible, right? There are professional athletes, there are high-performance race car drivers, there are Stanley Cup champions. I'm Canadian, so I'll pick a hockey example. There are people that summited Mount Everest with diabetes. So we know that this is a condition that can be managed and that people can excel with. It's not something that should limit somebody, but it's never gone to space. So there are things that we've done here on Earth that we can now start opening up doors for in terms of spaceflight for these folks.
And with the monitoring devices, like I'm a big fan of biometric monitoring in extreme environments. And so like with the patches where you can send a text to somebody in another country that tells them your blood sugar, and it does it automatically because it's too low or too high. And then with the infusion pumps and I love that. Yep. Is there any research and development into like biometric monitoring suits or anything like that going on there?
There's a lot in the industry. So one of the things that Axiom Space doesn't do but does do is we're not a research foundation, right? Okay. We're not doing our own research, but we're providing the facilities and the access for others. So that's good for the industry, that if somebody has an idea that they think might benefit from being flown in a microgravity environment or flown on a spaceflight mission, and then has impacts back here on Earth. Because if you can monitor somebody in space, you can monitor somebody Antarctic, right down at the South Pole station, or on a cruise ship, or even Mima and Grandpa in their own home, right? They don't want to go into a facility. They want to stay in their own home, but their kids and their family members may be worried about them and they don't want to move in with them. So allowing them to be independent, you can come up with a monitoring device that lets you know that, right, grandma just woke up and she's doing well, or grandma's still in bed and it's 10 in the morning and that's unusual for her. I should go check on her. And it could be anything, right? Maybe she's sleeping in because she's going to take advantage of not having anything to do for the day. Or maybe she's got a urinary tract infection or some other medical condition that you can catch early. It's not gone soon. Gone should be the days where somebody shows up in the emergency department with a loved one where they say, I haven't seen them in 5 days and I went and checked on them today and I found them like this. And they're further along in their medical process than they would have been if you'd had a device like this. Yeah. So again, right, the stuff that we do for our missions and supporting our goal and our astronauts, there is potential for that to have big impact here on Earth.
I love that. So this is a little bit of a tangent. Do you have a favorite handheld portable ultrasound device?
Definitely. And I'm going to start this off by saying that I own no shares in their stock, but I'm a butterfly guy. And I think most of the world probably is. Yeah. And the reasons for it are fairly simple, right? It was one of the first ones on the market. And so I got involved with it early. I got mine shortly before COVID. And as an ICU doctor during COVID, my stethoscope was sort of useless, right? Everybody's lungs sort of sounded okay, but you were seeing pulse oxes in the 60s and you were having problems with the ventilator, the pressure and the numbers that we were seeing on that were disconnected with what we were hearing with our stethoscopes and auscultation. But I found that the butterfly gave me fantastic information, right? You could see B lines and you could see pulmonary edema and pleural effusions, and it was robust. It fit in my pocket in my white coat. It plugged into my iPhone. I could, right, it's not based on crystals, it's a chip. So if I really wanted, I could use it as a reflex hammer. But I mean, you can drop the thing and it still gets the same quality image as it did before you dropped it. Not that I'm advocating that people kick their butterflies around, but it's robust for an operational environment. And so for a space company where we're launching people from Cape Canaveral, we're recovering them on an offshore vessel right now with the SpaceX boats. I want something I can put in my flight suit pocket or in a backpack, put on a helicopter, drop on a ship deck, pick up when I need it. They can get wet. It's robust, a pretty reliable device. I bought 2 of them in 2019 and they're both still working.
I got mine before COVID too. And like when we were in the field hospitals and like all the hazmat gear, I couldn't use my stethoscope at all. So whether it was useful or not, I had no idea. And just trying to figure out like who was the sickest, you know, just from a pulse ox, like everybody had a terrible pulse ox, and I found it extremely helpful in that environment also. I loved it.
Yeah, the other thing that was great for was troubleshooting, right, the ventilator. That if you were getting an alarm on the ventilator and you were worried, is the tube disconnected? Is that why we're having problems oxygenating and ventilating? Have we malplaced it, or is the cuff blowing, or have I right main stem this? What's going on? That you can, or do I have a tension pneumothorax that I'm making worse because I've got a PEEP of 20 and a tidal volume of 450 that I need to do something about this. And you don't want to put a needle in somebody's chest or put a chest tube in unless you need to. But with the ultrasound and having it in your pocket, that you didn't have to send somebody out, they had to, right, get out of all that hazmat gear, go down the hall and find the ultrasound that may be being used in another room. You could just get a preliminary answer very, very quickly and make a clinical decision was invaluable.
Yep. I love mine too. Any special considerations for managing pain and discomfort in space? Like, we found when we did joint injections down in the undersea habitat, it increased pressure. There was like there was more back pressure than I expected there to be. And like when we were drawing blood, their blood came out a lot faster than I expected it to. It was like, whoa, okay, pull that tube off fast. And so do you do injections up in space, or do they ever have to draw blood in space, or and also like how would you manage pain and people being uncomfortable in space?
Yeah, so blood gets drawn on a regular basis, usually as part of a research experiment.
Mhm.
That somebody's got a payload that they need blood to follow whatever markers that they want. So most of those samples would get centrifuged, spun down on the ISS, stored, and then returned to Earth for analysis here. It's very rare that blood would get drawn for a medical evaluation
Sure,
of an
sure.
astronaut. Um,
Ours was research too.
yeah. The injections primarily. So if we're going to give somebody an injection to manage a medical condition, pain's one of the conditions. The other more common one is nausea and vomiting, right? So if you failed oral meds or you're just not able to keep the oral meds down, then doing an IM injection of something like promethazine is not uncommon. It used to be the practice for shuttle flights that you would go see the flight surgeon before launch, and they would mark on your buttock where the injection was going to occur, so that then a non-medical crew member or yourself could give the IM injection. We're not continuing that practice at Axiom Space, but it is something in the training. The challenge with injections, and again, this is one of the differences between spaceflight and terrestrial medicine that people may not consider, is how do you drop the meds, right? If you watch folks drop meds on Earth, they flip the vial upside down, gravity brings the fluid to the bottom, you put the needle in, and you draw up from that collection of fluid that gravity has nicely put in proximity to the needle. You don't have that in space. So you get, and surface tension being what it is, you get a collection of fluid that now you're doing some gymnastics inside that vial to try to get the other thing you can do is you can centrifuge it, you can spin the bottle to get the fluid to go to where you want. But even after you draw it up, there's some challenges that you've got some air bubbles in that fluid that you then have to spend some time maneuvering out of the fluid and get them up towards the tip of the needle so that you can clear that before you inject. Doesn't matter so much if you're doing an IM injection. It would probably matter more if you're doing an IV injection. You would slow your rate. So that's one of the reasons that we do IM preferentially. But right, even something as simple as that. And so if you think, right, I'm drawing up promethazine for motion sickness, I've got time. That's something I can do. But thinking back to the worst day, and we talked about it, CPR, if you're doing an ACLS algorithm in a microgravity environment, right, how often are you giving meds during a code situation? Every 3 to 5 minutes for the epi. If somebody wants to give calcium, if you want to give bicarb, if you want to give D50, all those meds that are in that algorithm, you're giving on a fairly regular basis, that you're not going to be able to keep pace with that. That you're just not going to be able to draw up the meds and be able to administer through an IV setting. So there are, like I said, things that are very, very simple and that we take for granted here in the practice of our day-to-day care. You put it in a microgravity environment, you're going to start encountering some issues and some challenges and some limitations that you hadn't thought of until that happened.
Yeah. Yeah.
So
it's
primarily oral IM injections. Those are the way. Simple is always best. And that's even for terrestrial boards, right? When you're looking at a board question, you've got 4 different choices. The simplest, the cheapest, and the lowest impact on the patient is probably going to be your best choice. Same goes for spaceflight.
Yeah, that makes sense. It's a phenomenal added degree of difficulty. And so, like, how do you all utilize telemedicine for diagnosing and treating medical issues in space?
That's all we've got. So we have, like I said, there's a crew medical officer for the crew up on our missions. And we also have private medical conferences, PMCs, with our crew. And they're scheduled before launch. So there are scheduled ones. And then if something occurs that they want to talk to their flight surgeon, then we have an unscheduled PMC. They just call down to our mission control and it gets set up. And so we have a mission control at Axiom Space that's actually sitting directly below me right now. And there's a console surgeon spot for our docs that are supporting the missions. And it's integrated with NASA, it's integrated with SpaceX and ESA, anybody else that we've flown with so that we can work collaboratively with our partners and the other entities in the industry. If somebody has a medical condition, then we privatize the loop to protect patient confidentiality, and we have a conversation with them. And it may be a conversation of back and forth over the radio where we're asking them to describe something, or we may have a video link, or we may have them send us a picture of whatever it is that they're worried about, and we can look at that as we're having the conversation. And then afterwards, we'll follow up the same as you would go back and reassess your patient in the ER or in clinic. The same thing, right? You're going to give treatment. You'll go back and reevaluate, and you'll either continue with the treatment or you'll pivot and make another change. And that can happen a number of different ways also, right? We can have another PMC where we ask them how they're doing. We can send a message. And so we use Teams primarily as our form of comms, because it's got a secure aspect to it that we can, like I said, maintain the patient confidentiality. It's just the product that we happen to use. But any of those, right? You could probably use Zoom. You could probably use WebEx, whatever the company's decided that you can be in constant communication with the crew. The good news is the delta in terms of the delay is seconds to low Earth orbit, right? I think it's 1.2 seconds for data to transmit. A little longer when you go to the moon, and then it's into the minutes when you go to Mars. So it will be something that, as we go as a species deeper and deeper into space, may become a problem. But I'm also fairly confident that we're going to see changes in technology that what we think may be a problem now, in 10 years, somebody will come up with a solution that will have shortened some of that, if not totally negated.
I'm pretty impressed with the technological advances over the last 10 years.
Yeah.
I mean, when we were kids, did you think we'd be walking around with cell phones? Like that was Star Wars and Star Trek type stuff back then.
Right. Yeah. And I think I've talked about this offline, that the Apple Watch is a Dick Tracy watch. And so the thing that everybody thought was ridiculous back in the 30s, the 40s, and the 50s, it's reality now.
It is. It reminds me to do everything. Like I set timers to go recheck a patient if I want to recheck them in a certain amount of time. I set it up. It texted all of us when my dad fell. Like we all knew that my dad had fallen and not gotten up, and it already called 911 for him. It like did all this stuff. It was, never in a million years would I have predicted this 20 years ago.
Nope.
So I can't wait to see what these smart people do what you smart people do in the next 10 or 20 years.
If you look at commercial space, right, we're starting to hit the steep part of the graph, that the first couple of flights, right, the things happened in 2010, then there was something else in 2012, and then 2015, and then 2017, 2019, 2020, 2020, 2020, 2021, 2022. Like we've started to go exponential with the firsts and the frequency with which things are happening. So the next 10 years, the technological advances that come out of addressing the questions, right? Necessity is the mother of ingenuity. The things that we're going to see are going to be incredible. I'm excited for my kids, right? They're the generation that this will become very routine. My kids are sort of bored with spaceflight now, which irked me when it first happened, because I was like, this is exciting. You should. And then I thought, no, from your perspective, this is
normal.
Right. And that to me, when I started to look at it from their eyes, that became really exciting too, that this is normal. You've accepted this as something that spaceflight is a thing. It's not a novelty. It's an accepted thing. And someday I joke with them that they're going to be the ones taking their kids to lunar Disneyland or whatever resort it is that we've got on the moon for a weekend.
Sure. Yeah. I mean, I still get excited when I feel the G's from just a commercial flight taking off. Like I'm still so impressed that we can do that. Like it's amazing.
And even looking back on that, right? 1903 was the first flight, a couple hundred meters down on North Carolina beach. And then in 60 years from then, we were flying people across oceans. We were transporting mail, and we were getting ready for jet flights, as well as starting to talk about rockets and going to the moon. So how quickly, right? 60 years, we went from not flying to space flight. What's the 60 years from now that we've now gone to space flight for commercial entities and possibilities for anybody, to 60 years from now, where are we going to be?
I love it. I love it.
It's exciting.
Yeah. And so what specifically for Axiom and you guys, what exciting news is on the horizon for you?
Lots. We are very, very busy here at Axiom Space, and we've got a lot of projects going on. So we've completed our first 3 private astronaut missions. And they've had changes across the three of them, right? Our first mission, AX-1, in April of 2022, had an experienced NASA astronaut, Mike Lopez Alegria, and 3 individuals who were self-paying. And they went up and they did a lot of exciting research for organizations. Right, I'm proud that we had a Canadian, we had an Israeli, and we had an American citizen that had all partnered with health institutions and research institutions in their countries that they were doing projects for them. AX-2, a year later in April of 2023, we flew the first female astronaut from the Saudi Space Agency and introduced a new country to space as a professional organization, right? The Saudis have got a space agency, and they've got long-term plans that some of the individuals, the 2 individuals that we flew and their 2 backups are going to be career astronauts for them and are going to fly again someday. AX-3, which just flew in January of this year, had 3 individuals that were all professional astronauts, one for the Italian Air Force, one for ESA. So it was the first time that we've flown a partner agency astronaut as a commercial astronaut. And then we introduced another new country in the Republic of Turkey. We flew their first astronaut. Same thing. Tupatak is their space agency, and they've got a long history of flying satellites and payloads, but now they've ventured into human space, and they have aspirations that the 2 astronauts that they picked are going to be career astronauts, and their second one's going to fly in a VG flight here in a couple of months. On top of that, we're hard at work building a space station. And so the Axiom Space Station is going to replace the International Space Station. And it's not a concept. It's a reality. Steel is being welded together, structures being built, and it'll be flown over to Houston, where we've got a high bay over at Ellington Airport that we will start outfitting it for space. And so we will replace the International Space Station. The first segment is going to fly in 2026, and we've got a pathway to make it an independent space station, and it's going to be a research and manufacturing lab for anybody and everybody that's potentially interested and has a project that would benefit from being conducted in microgravity. The third thing that we're doing that's really exciting is we are building the next generation of spacesuits. So the EVA suit, the extravehicular activity suit, that the Artemis crew will use when they return to the moon in the near future. It will be an Axiom suit that they wear when they go out the door and do the next spacewalk, the first since the Apollo era, on a celestial body. The same, we're developing the suit that is going to be used for some of the EVA work that NASA is going to do on orbit. And it's exciting. The suits haven't been redesigned in 40 years. And so we've talked about how quickly technology and the advances occur. The things that our team is working on with our suit to update it for the first time in 40 years, we're taking advantage of 3D printing and new technologies in terms of textiles and Eclipse systems, how you support that, right? It's a small space vehicle that you've got somebody, you have to supply them with oxygen, you have to manage the carbon dioxide, you got to keep the temperature and the humidity inside the thing to a comfortable level, right? All the technology that we can now bring to bear in that project is just incredible. And they just recently got an award at a Rotary Club dinner here in Houston last week for the accomplishments and the advancements that they've had.
Oh, that's so exciting. I love
It's a great
that.
spot to come to work. It is.
It is so great. I mean, yeah, my dad used to get excited because he did a lot of work on breast cancer and bone metabolism, and he had a lot of projects going up to the International Space Station. And I remember him talking at dinner that, you know, this was very exciting that they discovered, you know, different things up there, and it just, oh, it's so fun.
Yeah.
That's incredible. That's just incredible. That is so exciting. The future is bright. Anyone interested in aerospace medicine should head on down that path, I think.
Definitely. It's a
I
rewarding
love
one.
that. Mm-hmm.
Yeah.
And so for a young medical I know the real answer is quadruple boarded, but for a young medical professional who looks at you and says, you know, wow, I would really like to be a part of that or be going on down that path for them, and I want to do that. What advice would you have for them?
Have fun is the most important one, right? There's nothing that I've done on my resume that I've done for the sake of ticking a box and fulfilling a requirement. I've been fortunate that the things that I've enjoyed have fulfilled requirements to get me to where I am today. But even if they hadn't, I still would have done them. I enjoy scuba diving. I enjoy flying. I enjoy going to work in the ER and in the ICU. And I think because of the fact that I enjoy them, that's part of what has made it something that I can be successful at. So if you find something that you love and you're passionate about, you'll be willing to put in the hard hours and do the hard work to become very good at it and to really hone your craft and understand your field. I don't think that being quadruple boarded is required, but I do think that being boarded is required. And that's one of the things at Axiom Space that we place a significant priority on, that it is important to us. We've got 4 flight surgeons right now. We've got a 5th that is starting here in a month and the end of June, that is going to be board eligible. It's coming from a pathway that will make him board certified when he sits and takes the exam. That's important to us. It's a quality metric, and it's something that as an industry leader we place a lot of importance on. That it's a way of we can show our customers that we're taking this seriously. We're taking the medical side of it seriously. We're taking the engineering side of it seriously, and it's a high class product that you're being offered when you're being offered an opportunity to fly in an Axiom Space mission. So look into those pathways that get you board certification and make you the best candidate that you can be, is incredibly important. Don't take shortcuts. Take your time. Learn the opportunities and the lessons that are presented to you all the way along through residency, right? There are things that somebody may present to you an opportunity and you might think it's easy to say no, or it's not a good time for that. One of the things that or I guess 2 of the things that I've learned in life is don't say no unless there's a really good reason, that right, ethical or legal reason why you should say no, or it is something that on careful evaluation doesn't fit in with your path and your where you're going, your priorities. But a lot of times if somebody provides you with an opportunity, there are lessons to be learned from any experience, whether it's good or bad, that take advantage of that and take advantage of trying new things and learning the lessons that those around you are willing to provide.
Say yes and figure it out.
Yeah. And the other thing is I've discovered that there's no real good time for anything, right? Everything, if you look at it from a certain perspective, is inconvenient because it's not how you thought it was going to be presented to you or when you thought it was going to be presented, or you've got other things that you want to do. But if an opportunity presents, that's probably a good time for it.
It is. It's funny like that. Sometimes you think, oh, I can't do that because I have to do this. And it's like, no, just figure it out.
Yeah. Reevaluate the priorities. Yes. Maybe this is the time to do that.
Yep. Yeah. And where did you do your aerospace medicine fellowship?
I did it in Rochester, Minnesota, at the clinic up there, which when you think about it is not right what you would think is a bastion of aerospace medicine.
But it is.
Right. And they've got a history going back to World War II. Some of the early high altitude work with the bomber crews in terms of providing supplemental oxygen to them, the capability to bail out of high aircraft at high altitude safely, as well as some of the early G research. And so the very first centrifuge that wasn't at a government institution in the United States was at the Mayo Clinic in Rochester, Minnesota.
Yep.
And they were developing the pants that you would use to support high performance pilots when they started pulling positive G's in the GZ direction, where the blood would pool south. So the opposite of what you see in microgravity, but it would cause pilots to lose consciousness. And if you're unconscious in an aircraft, you're going to go all the way to the scene of the crash. And so some of the important work that they were doing still persists, right? The legacy is still there as a result of that. And again, it goes back to what I was saying about take advantage of opportunities, say yes to things, and persevere. Because there were folks that were giving me career advice early on that if you want to get into the space program, going to Minnesota is not getting you closer to getting into a space program or a form of employment. And not true.
Not true. Yep.
Yep.
It seems like you were gonna end up where you are almost no matter what you did, but
I
I think
got
it's important.
right place, right time.
No, right place, right time, but right man for the job too. Right man too. And in Rochester, do they still have? I used to love the Rochester airport because they had that first centrifuge that they built at Mayo with like the test dummy guy in the flight suit, and you could see it at the airport in the museum. It was
I don't think
incredible.
it's there anymore, but could be.
No, maybe it is. I hope it is. That was really cool. Well, yeah, Mayo Clinic is definitely on the forefront of so many things also. And I love how they're willing to partner. Like sometimes people don't even know, like they helped develop the cardia device, they help develop different things.
Some of the payloads that we flew on AX1 were Mayo Clinic payloads.
Oh, that's great.
Larry Connor's got a relationship with Mayo. Yep.
Yeah, awesome.
So his patch was on his flight suit. The Mayo Clinic patch was on
Oh,
his arm.
great. Oh,
Yeah.
that's cool. Wonderful. So any other parting thoughts for our guests? I can't thank you enough for spending the time with us today. I really appreciate it.
Thank you. It's been an absolute pleasure. This has been fun.
Absolutely. Well, ladies and gentlemen, Dr. Mike Harrison, so grateful. And people can look on Instagram and see more about Axiom Space and check out their website. And I thank you so much for being my guest today. You're truly inspiring and your career is amazing. And I love, one thing I wanted to say, I love the global aspect of all of it. We're not just like, we're going to do space, and it's, yes, we will help you. Yes, we will help you, because I've always wanted us just to be Earth. And I love it that Axiom is partnering with other countries and fostering good relations. And I think that's more important than anyone realizes, especially in this day and age.
Definitely. I think it's very cool that if you line up our mission patches, all the flags that are on the patch from all the different countries.
I love it. I love it. I love it. I love the collaboration, and I love the collegiality of that. And so thank you again to everyone listening. I'm Dr. Sarah Spelsberg. It is my pleasure to share these extreme medicine adventures with you. If you're listening to us, you too are an extreme medic, and we welcome you to the World Extreme Medicine family. Stay safe out there and always keep pushing your boundaries further. Hope to see you at our annual expo. Thank you.
Thanks for listening to the episode. Please feel free to rate, review, and subscribe on whichever platform you're listening to. Please also head over to the World Extreme Medicine website, where you can find more engaging content on extreme medicine webinars and indeed a collection of courses from our global network, including humanitarian, disaster relief, expedition, space, military, tactical, and performance medicine. Thanks again.